Representative Cantrell, thanks for joining us today.
My pleasure.
So it's been about a little bit over a year since we last talked to you. We talked to you for a new member interview last year. What has the last year been like for you representing your district, 56A?
The last year has been absolutely incredible. I've had so many opportunities to learn from my constituents, both in terms of what they are struggling with in their personal lives, and sometimes I can just be somebody to listen to them and a shoulder to kind of lean on in times of struggle. And sometimes there are ways that I have found I am able to work within the system of government to help resolve either kind of consternation that's a result of government bureaucracy, or sometimes just shortcomings in existing statute. It has been a tremendous learning and growing experience for me personally, learning about all these other complex areas of law. Especially health and human services, which is one of the areas that I'm extremely passionate about, making sure people with disabilities are able to access all the rights and privileges of society, and so that all people can live in equity. And learning about these complicated mechanisms that exist in law that end up creating a system in which prescription drugs are becoming more expensive. Health insurance is unaffordable for a lot of people. It has been one of the most absolutely humbling learning experiences of my life, and I've loved every single minute of it.
And you kind of have an interesting story about how you ended up here at the Capitol as a member of the House of Representatives. For people that might not know, you're a cancer survivor. Mm-hmm. Can you tell us a little bit about how you got into this position, how you ended up running for the House of Representatives?
Absolutely. So I was a student at the University of Minnesota Twin Cities when in December of 2016 I decided that I was going to take off a spring semester 2017 because I was feeling a little under the weather. I didn't exactly know what was going on. And it was towards the end of that one semester break in late May of 2017 when I was diagnosed with stage 2 Hodgkin's lymphoma at the age of 21. I had a few tumors in my neck and then a very large tumor in my chest. And that's when I really started to think about my privilege of being able to afford health care in a way that was affordable. I was, as a result of the Affordable Care Act, of course, allowed to still be on my mother's health insurance. She's a nurse, or she was a nurse at St. Francis in the Labor and Delivery Center at the time. So we were able to focus really extensively on just being healthy, getting better, instead of worrying about whether or not we were going to lose our house or lose our car, or potentially I would have to lose my life and try to crowdfund my survival, as so many people have to do, as a 21-year-old with cancer. So I began really thinking about how can I turn this really traumatic, difficult experience of going through chemotherapy, of going through cancer treatment, and dealing with a life-threatening illness into something that can help other people. So I began volunteering as a hospice companion, and I began learning a lot about kind of what makes up our healthcare system. Why is it the way that it is, where so many people have such great difficulty in accessing even basic care, but let alone ongoing life-saving care for chronic and complex illnesses. So it was in about June, July, while I was receiving my chemotherapy infusion, that the United States Senate was deliberating the repeal of the Affordable Care Act without a replacement. And that's when it really clicked for me that so many people who sit in all levels of government have such a detachment from what the struggle is like for people who are having great difficulty affording the cost of health care, whether that's insulin, whether that's epilepsy medication or premiums or deductibles. And that really emboldened me to begin to think about what I can do to alleviate these barriers to accessing quality and affordable health care. It wasn't until I was hospitalized October 1st to October 10th of 2017 for a nearly fatal reaction to one of my chemotherapy drugs. It's called a bleomycin lung toxicity. I nearly lost my life, that I decided that I think that I'm here for a reason, and especially at that point in time, that reason I think was to walk out of that hospital and ensure that every single person was able to get the life-saving medication and treatment that I was fortunate enough to receive. So less than 2 weeks after I left that hospital, I began my campaign for the House of Representatives.
Besides that, you're also probably the youngest, I think you are the youngest member here at the House. So you're a cancer survivor, the youngest member at the House. What perspective does that give you on policy and issues here?
Yeah, so being a cancer survivor, being the currently youngest serving member of the House, it allows me to, I think, still be able to talk with my counterparts who are maybe just starting out in adulthood, facing down these struggles and difficulties that I think are contemporary and ubiquitous to our time, of worrying about accessing quality post-secondary educational options, affording the cost of college, textbooks. How am I going to be able to survive and pay rent and buy food and pay for school when I'm only making $12 an hour, working 25 hours a week? So I think it allows me, because it wasn't too long ago that I was making $12 an hour trying to make ends meet. It allows me to really kind of center the contemporary struggles and difficulties of young people, of young adults, of people who are starting out in this really kind of difficult world where it's become more and more difficult to survive. It's become more and more difficult to thrive, to build a career, to have any semblance of financial stability. I would like to say it makes me more relatable to the high schoolers and the kids who I speak with. I don't think that's the case anymore. I'm starting to get to the point where I'm the old guy who comes in and I eat up about an hour of time, and that. But it helps me to center and to focus on these contemporary struggles that people are going through in a way that I feel that when somebody has been removed from that for a long period of time, is more difficult for them to really understand what exactly this experience of being a young person trying to make it in this world early on in our lives and careers, understanding how difficult that really is.
Sure. Do you think the legislature could use more youth?
I absolutely think the legislature could use more youth. I think we are the ones who are going to have to face the consequences and ongoing struggles of these issues and of these policies that are passed in the legislature longer than anyone else will. So I always encourage more young people to run because they bring a perspective that is entirely reflective of the current situation, the current kind of environment in which people are trying to find a way to thrive and to grow. But many of us run into difficulties because of how difficult it has been for working class people, for young people, to overcome this system that has developed largely because of corporate greed, largely because of policies that have been made that are not in our best interest because they were not made with young people, with us at the table.
And when you talk to constituents or when you talk to people out in public, what are you hearing from them? What would they like to see addressed in 2020?
In my community, and I think communities across the state of Minnesota, two of the biggest issues are ensuring that we have a fair and robust system of education financing that couples the financial stability of our communities with also the financial solvency of our schools, in ensuring that every single student, no matter where they are, is able to receive a quality education from the earliest stages of life until they're ready to go into either the career world or the workforce or go on to post-secondary. And then people, of course, are concerned about accessing the outrageous cost of medications, the outrageous cost of healthcare in general. It's something that has become so complex, so inefficient and ineffective that that it really is independent of whether or not you might be making $300,000-$400,000 a year. You're still, if you have a family, you're still going to be paying through the nose for healthcare costs, and that has to stop. I mean, people are kept awake at night thinking about what did I do wrong? I went to college, I have a career, I did everything I thought I was supposed to do. But it's still elusive, that financial stability that I thought was waiting for me at the end of this, at all this hard work, at the end of this long journey. So education, access, and financial stability, and then of course healthcare affordability are two of the biggest issues that people in my community are concerned about, and two of the issues that I'm going to be working on extensively, both leading up and throughout the next legislative session.
And just finally, before we let you go, you have announced that you're not going to run for office next year.
Yeah.
How did you come to that decision? And is this the last we're going to see of you, or are you going to continue in politics somewhere down the road maybe?
Well, I will always be an advocate for people who are suffering from injustice, people who are not benefiting from the current legal structure and statutory framework of our state. I decided after a lot of really difficult reflection that as much as I absolutely do love serving my community, I absolutely love being able to wake up every day and find a problem or have somebody bring a problem to me and work on solutions to those problems. It is the most incredible and humbling blessing of my life to be able to do this. I decided that I also need to finish my education and pursue medical school while that is still an option, and while I still have time to do that. Because if I've learned one thing from this entire experience, the entire arc over the last couple of years, it's that not a single day is guaranteed to us, and I believe life should be full of challenges and of different experiences, and I also think that government thrives, in that good public policy thrives when the baton of leadership is handed off frequently and freely. So I love being able to serve my community, and I'm looking forward to this next legislative session.